MTN News, this is Montana This Morning.
I'm Jonathan Amberian in Helena. I'll let you know how health departments across Montana may have to shift their COVID quarantine protocols to keep in line with a state law prohibiting discrimination based on vaccination status.
Health officials in Butte are encouraging more people to get vaccinated as cases of COVID-19 continue to climb. I'll tell you about it coming up.
6:29 on this Thursday. Chet Lehman, Matt Elwell, and apparently a couple of Johns.
Yeah, John and
Jonathan, John. You will have those stories for us. You have the weather story for us here on a pleasant morning.
A little crisp out toward West Yellowstone. I don't think that comes as a shock to anybody.
No.
30s there. Most areas into the 40s. Cool morning, not as crisp as it has been, certainly. The afternoon holds that potential of a few thunder showers as you go later into the day. It's not going to be widespread, and we may just kind of see those showers kind of pass us by. Similar to yesterday, probably not as intense of a thunder shower expected. Daytime highs into the 70s. It will be a little breezy with a northwest wind as you head out throughout the day. I'm going to talk in depth about that weekend forecast. It's interesting. You won't want to miss it.
There you go.
Is that a tease or what?
Well done. Intriguing. 6:30, our top story this half hour. Rising case numbers and a law passed by the 2021 legislature have health departments re-examining quarantines for the vaccinated and the unvaccinated. MTN's Jonathan Amberian looks at how the policy is changing.
In recent months, public health leaders have said one benefit of getting the COVID-19 vaccine is that fully vaccinated people won't have to quarantine if they're found to be close contacts of someone who tested positive. However, local health departments across Montana are now considering whether they'll need to change that policy in light of a state law that prohibits discrimination based on vaccine status.
We have had to make some adjustments to our operations in order to balance the CDC recommendations around quarantine and the restrictions placed upon the situation.
The CDC has issued updated guidelines saying close contacts who are fully vaccinated only have to quarantine if they develop symptoms. But House Bill 702, approved by the legislature earlier this year, says government agencies can't deny anyone advantages or privileges because of their vaccination status. Lewis and Clark public health leaders say to stay in line with that law, they're no longer issuing quarantine orders for anyone. Instead, they'll send close contacts a letter asking them to follow public health recommendations. Quarantine if they aren't vaccinated, and masking and testing if they are.
The message is essentially, we need this community to follow these instructions if we want to get past the negative impacts that we're experiencing with COVID.
Lewis and Clark County Health Officer Drenda Neiman felt the only other option to comply with the law would be to require everyone to quarantine for the same length of time.
If we were to quarantine fully vaccinated individuals, we have students out of school that don't need to be, and we have workers out of work that really don't need to be, and which has a pretty significant snowball effect within our communities, and it's quite disruptive.
Many health departments across Montana are considering how to address this same issue. Some are taking a different path. Missoula's Board of Health has decided to keep quarantining unvaccinated close contacts, but not vaccinated ones. Board members acknowledge that could lead to a lawsuit. For the next few weeks, it's likely that not every close contact in Lewis and Clark County will even receive a letter with recommendations. Public Health has shifted their contact tracing strategy to focus on household and high-risk contacts, saying they don't have enough staff to fully trace all the new cases in the area. Neiman asks that anyone who knows they've been exposed to COVID follow the recommendations anyway. In Helena, Jonathan Amberian, MTN News.
And with a second wave of COVID-19 cases appearing in Butte's Silver Bow, health officials there say it's more important than ever for people to protect themselves by getting vaccinated. MTN's John Amy picks up that story.
Health officials in Butte are finding it hard to encourage more people to get vaccinated as cases of COVID-19 continue to climb in the county.
In the beginning of summer, we were vaccinating maybe 25 to 30 a week. You know, it was not a good number. We were really struggling at our pop-ups, giving 2 or 3 shots at a clinic. You know, the numbers just weren't looking good.
Butte Silver Bow has a vaccination rate of 60%, the second highest in the state behind Missoula County. Butte reports there has been a slight uptick in vaccinations in August.
Now with school starting again, the Delta variant that is spreading so fast, and it's a vicious virus, I think has people thinking, you know what, it's time to get our shots. We want our life back, and I guess this is what we're going to have to do.
Town Pump continues its vaccination sweepstakes, which is a weekly drawing in which 2 vaccinated people can win $10,000 and 3 vaccinated people can win $5,000. They've already given away $300,000, and the weekly drawings will continue until the end of September.
We know that for our schools to be safe opening this year, for us to have full stands at Naranchi Stadium on Friday nights, that we need to have people vaccinated. And so part of the goal of this was to get those numbers up.
Health officials say it has been both physically and mentally exhausting for them to see this new spike in cases, especially after working so hard at the beginning of the year to get people vaccinated.
It's really hard. You know, a lot of us gave up a lot of our lives, worked a lot, did a lot, just feeling like we were getting to something, feeling so good, thinking we're going to beat this, this is going to happen. But with the second go around, it's a little bit harder. So we're still here. We're going to keep going. It's just a little bit raw.
Montana Department of Health and Human Services reporting 604 new cases of COVID-19 in the last 24 hours. That makes it 4,109 active cases in the Treasure State right now. Last time the state reported more than 4,000 active cases was back on January 27th. Cascade County added the most, followed by Yellowstone and then Missoula counties. State Health Department shows Gallatin County 57% fully vaccinated, but with 41 new cases. Butte Silverbow 18 new cases. They come in at 60% fully immunized. There were also 5 additional deaths reported statewide. Now we're learning more about the Delta variant's growing reach in Montana. Montana Acting State Medical Officer says the Delta variant now making up the majority of samples sequenced. Montana Department of Health and Human Services reports of the 58 samples sequenced first 2 weeks of August, all were identified as the Delta variant. Cumulatively, the Delta variant makes up more than a quarter, actually 28% of all variant cases in Montana. Health experts say people infected by the Delta variant generally twice as likely to spread it. The Alpha or UK variant, which was the dominant variant strain prior to Delta, makes up just over half, about 53% of all Montana variant cases. Now, COVID continues to spread with cases rising rapidly again across the country. While most people do recover from the virus, some have lingering symptoms that last for months. MTN's Russ Riesinger spoke with a Billings woman who's still struggling after testing positive at the start of the year.
I was very active. I think I've only had the flu once my whole life that I can think of. I'm sure I did when I was a kid, but never sick.
That all changed back in January for Sally Strom after being diagnosed with COVID-19.
This year has just turned my life upside down.
Unlike some people, Sally never had to be hospitalized, but more than 7 months later, she continues to suffer from unexplainable and mysterious symptoms.
It first started with my vision at my computer. All the words combined together. I couldn't make out a number, I couldn't make out a letter. My knees ache. Sometimes I hobble around like an old lady. I get winded and I have to sit down. I can't, my body, the fatigue, the headache. My speech is a little, it's hard for me to get words out. It really messes with my brain, my balance, my dizziness, my concentrating. I don't drive anymore.
She's what's known as a COVID long hauler. She says it's a chore now just to water the flowers in her yard, and some days she can't even get out of bed.
First they thought what they were seeing is people were getting better after 3 months. So it's like, okay, I'm almost at the 3 months. 3 months came, I'm not any better.
Sally is not alone. A meta-analysis of 48,000 patients found a large percentage of those diagnosed with COVID develop one or more long-term symptoms that continue to linger. The most common were fatigue, headaches, attention disorders, hair loss, and difficulty breathing.
Just do anything you can to protect yourself. This is not fun. This is not no joke. This isn't exaggerated. It's not the flu. I lay there and I think, is this a life sentence? Because if this is a life sentence, I don't want to live like this, you know? You wish COVID would have just taken you.
In Billings, I'm Russ Riesinger reporting for MTN News.
Now, Sally tells us that she had planned to go to the Mayo Clinic next month to hopefully get some answers. She says that's now been delayed until November because of the rising number of COVID cases at the hospital there. We'll continue to update with her. Meantime, 6:39. Taking a break. When we come back, consumer interest in solar energy systems skyrocketing, especially here in the West. Companies say environmental concerns are part of the reason, but there's something else driving the demand. Learn what that other factor is after the break. But first, we're going to take a quick break. When we come back, Matt, of course, will have your forecast, all when Montana This Morning continues.